Mr. Minister, we have then to realize that we are launching something that is probably not easy to sell, to seek funding for. And yet, it is actually what is most critical. The National Public Health Institute we are launching, I know, will go beyond preventing diseases, preventing epidemics, preventing pandemics, and just promotion. It will also look at research. So if we know why things are happening in the health sector, then we know what to do. So research in public health may actually be more important than the research in the clinical services. Because if you research in public health prevents diseases, then you don't need to do a lot of research on diseases. Again, when you come to funding, and next week we are meeting, I know this is the way we are going to have to look at it. How do we finance it? So when we launch this institute, which I'm really happy that is coming into being, I must say it stayed too much in the term because I don't remember it very well. A pediatrician should have known that a baby is coming. Now we are seeing the baby when it is being born, but we will look after it, and I think it will do a great job. But after we launch it today, I've been informed that it is actually now established by a legal notice. You and I know that a legal notice can be changed on Friday. The person who signed it can design it on another Friday and it no longer exists. Therefore, I think after it has been, we have established, the biggest thing now is to actually look at how we entrench it legally, so that we need an act of parliament to entrench it. And I think between you and me, that would be easy to do. You know that if people are opposed to it, you know what you used to do. All the people who are opposed to the bill would get trips when he was launching the bill. But we are not going to. But a few of us used to see through his tricks. Or he would come with it very late in the evening. Some of us would be coming. We know now he's coming with that one. So we just we'll not use those tricks. We'll just use what is acceptable, and we will get the work done. So if it is entrenched in the law, it is going to be a lot more powerful, and we'll have the strength that's required. Then we'll have to look at its structure. I'm happy that one thing that has already come out is the link with the Council of Governors, not just the Council of Governors, but actually with the counties, because these issues of health are actually at the counties. Anything you do in this country, you are doing in a county. There's nowhere else you do it. So that link, has been a challenge to our devolution. The link between the national government through the Council of Governors and the county. So I've noticed if they were saying that they need membership in the board, I think that goes without saying. But we look at it once the baby has been born, we can see how to make the baby stronger. It is actually the Public Health Institute that will put together all the social determinants of health. CS, you have a PS who is medical, you have a Director General who is medical, and they know that the essence of health is looking at the social determinants of health. If you put down the social determinants of health, you will actually know who to put in the board. Whether it's agriculture, whether it is industry, whether all these things contribute to health. So that will bring the social determinants together. If it works, and it must work, let me not say if, when it works, and it must work, yes, we can see a big return. They were talking of financing. Yes, it will be financed. But the money put in public health is amazing. The returns are amazing. In 2005, CS, we had an outbreak of what we thought was leptospirosis in Chesamis. We spent 30 million to treat the people who were affected. But when eventually we realized what the problem was, we spent 10,000 to actually clear the problem. Had we used that 10,000 earlier, we would have saved 30 million. So again, when we are financing it, we look at that it is the greatest savior. It's actually the greatest contributor to health financing. And CS, as I end, our biggest challenge, you and me, in the health sector today has to do with health financing. We are struggling with SHA, which you and me have said must work. If Kenyans have to believe us, must work. And what is that about? Healthcare financing. And when you look at public health institute, then you immediately think of primary health care. And you know, in our SHA, there is the primary care fund, which we have actually not handled. We have not actually funded it as we should. Now, if things are working, and you will probably not need as much in primary care fund as we need. So then we'll have to look at that. We'll need more money, the contributions people make. If diseases are prevented, that will also be less. The human resource, if we don't have to treat very many people, we do not need a lot of money, but we need to employ them. So we have the SHA finance, human resource finance. And then when people are sick, they will need drugs. Because even if you come and you tell me nice things and I go home without medicine, I will not have been treated. And that will take us to KEMSA, where we'll also need a lot of drugs. So if the new baby works well, grows well, saves us money, then we can be able to tackle more easily the major problems that we are facing as a country now. The challenge for me and you have been talking in Parliament, now we are going to be asked, now do it. You have been saying it. And therefore, this to me is a good move that will help us look at the financing we need for our health human resource, the finances we need for our insurance health financing system, the financing we need for our health products through KEMSA. It must be linked. We can't see it differently. So if this works, it is a good contribution to what our bigger agenda is. With that, I really welcome the launch of this new baby.
Thank you so much, Chair of the Departmental Committee of Health. You notice, Waziri, I couldn't stand up when the chair is speaking because I will get into trouble with Parliament. And I don't want trouble, sir, so you forgive me for that. At this juncture, I would like us to all be upstanding as we welcome the Cabinet Secretary for Health, who is our chief guest today. And today we baptize him as skilled birth attendant for the National Public Health Institute.
Please be seated. Principal Secretary, Dr. Omar Oluga, Principal Secretary for Environment, Engineer Festus Ngeno, my friend and colleague in Parliament for many years and the chair of the National Assembly Parliamentary Committee on Health, Dr. Nyekal, the CEO of Council of Governors, who is representing the chair of the Health Committee of the Council of Governors, Dr. David Ndegwa, the chairperson of the Kenya National Public Health Institute, the Secretary of SCAC, the representative, Dr. Lucy, the Regional Director, Eastern Africa, Regional Coordinating Center for Africa CDC, my brother, Dr. Diallo, the WHO country rep, Dr. Amoth, our Director General, distinguished guests, ladies and gentlemen, good morning. It gives me great pleasure to be here today, joined by the Principal Secretaries for State Department for Public Health, Professional Standards, presented here by the many directors from that department, and the Art of Medical Service, the chairman and the board of directors of the Kenya National Public Health Institute, distinguished guests, and all partners and stakeholders present. The Kenya Kwanza government, under the bottom-up economic transformation agenda, has placed health at the core of the national development. We are committed to strengthening the universal health coverage, enhancing preventive and promotive health care, and building a resilient system that supports a healthier population and stimulates socio-economic growth. Ladies and gentlemen, the events of the recent years, from the COVID-19 pandemic to the Ebola outbreaks in neighboring countries, have taught us hard lessons. They have demonstrated that no country is immune to global health threats, and that preparedness